So what we said last time, Botox is molecule the same like acetylcholine, okay? Acetylcholine, it is molecule, chemical come from the nerve ending, okay? The nerve end, this is the nerve, have some vesicles, this vesicles has acetylcholine. Once the impulse come from the muscle, from our nerve to the muscle or for the sweat glands, the vesicle come here and open and release acetylcholine. Acetylcholine attached normally to receptors on muscle fibers or the sweat glands. This is acetylcholine receptors. Okay, botulinum toxin, it is the same shape like acetylcholine, so it attach when I inject it, it attach to also the receptors of acetylcholine. But the difference is that acetylcholine attach like temporary and release direct, like it attach here and released. But Botox, once it attached, it cannot be released again. So after the Botox attached to these receptors, it became like one component, stay forever as long as the receptors is here. Normally our body changes the receptors every 6 months, every 3 months. I mean, like normally now we have in this area, in the forehead for example, some receptors, this receptors is for 1 month ago, some receptors is already for 6 months ago, some receptors, so these receptors, once the Botox attached to these receptors, so the old, like once we inject, like for example from the next month already we started to lose Botox because there is all the receptors already about to be damaged. So from each month our body change some receptors until after around, according to each body, some people after 4 months, some people after 3 months also, some people 6 months. So anyway, the best Botox on earth, if I bring the best person who have all his receptors fresh now, that just made now, and the Botox will attach to it all now, it will not stay more than 6 months. But what I need for Botox, what I need from Botox when I inject Botox is not to stop sweating for example for 6 months all, or to stop make paralysis of the muscle. This is not what I do. What I do with Botox is to restore the normal muscle function. The muscle is tense now, so tense, so strong, so big. It is, I need all what I need to make paralysis in this muscle temporarily, that muscles start to work again normally, you know. Okay, where I can inject Botox. If you don't understand anything, just tell me, okay?
Yes, okay, you can inject it from here. If it's problem here, we will inject it around from here, 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 here.
Exactly.
It can be even inside.
It's eyebrow. It should be very like
or very
just
close.
very close, just on the eyebrow.
Yes.
Like if the eyebrow like this, I inject here, or even inside here. It doesn't matter. Normally, even sometimes when people have so strong muscle, even we can inject until even the lower border of the eyebrow. Okay. So this is the face. This is eyebrows. This is the muscle. This is the mouth. Eyes. This is the chin. What is the zones of Botox? The area between the eyebrows, or these 2 lines or 3 lines, this is one zone. The reason of this is this muscle start from here, like this, contract in this direction, and one muscle also the same on the other side, contract in this direction, and muscle like this, contract in this direction. So when all together contract, it makes these three lines, like this. This is one zone. Second zone, the frontalis. Yes,
Forehead.
there is muscle all through. It's one muscle contract in this direction. So the action of this muscle already to lift the eyebrow. Okay. So if any kind of Botox I inject here, what is the action of Botox when I make paralysis? Makes the eyebrow down. Because the normal action, the muscle contract normally without Botox to lift his eyebrow. You should know that when I inject Botox, I make the opposite action of the muscle. Like when I inject Botox here, I make it like this. Because the muscle relaxed. When the muscle here, the action is to lift his eyebrow. If I make paralysis in this muscle, so eyebrow will fall down. So I should know in any kind of injection here, the effect that the eyebrow will go down also. Yes, I will release this horizontal lines here, but I should know that this will not go up. For example, this is the hairline. The hairline will not the one will go up because it's fixed. It's fixed like when you contract the muscle. Even normally, if you have men who don't have hair, and he ask him to raise the eyebrow, you will see this line because it's fixed. It can't move up. So what the action is, this is the origin of the muscle, and the muscle attached to this area here to lift the eyebrow up. When I inject Botox, it make it down. Okay. So this is the second zone. Why even we say one zone, like according to what we consider this one zone and this one zone and this together here, the sides, crow's feet, the sides of the eyes, one zone. Honestly, it's according to how many units. Like normally we use in this the area between the eyebrows, because it's very strong muscle, the same amount of units of Botox, the same like all this frontalis area.
Okay.
Come here. Okay. So also when this zone here and here, we use the same amount, like for example, we use like 20 to 30 units in each zone. Here 20 to 30, here 20 to 30, here and here 20 to 30. What is the difference? According to how strong the muscles. Some people have very, very strong lines here and they almost don't have lines here. So I should change the dose little bit according to how much strong I need to make it. Okay, and the sides of the eyes, it is one zone. What is why we have these lines here? Crow's feet, like this in the eyes, because there is orbicularis oculi, circular muscle, like this. Yes, it's divided like in three parts. There is one part in the eyelid itself, and another part, the middle part, and then the outer part. Anyway, this muscle contraction action is to close the eye firmly. Okay? So, if I put Botox here, I make the opposite. I open the eye. Like if I make Botox here, I normally the muscle contract like this. To close the eye strongly. If I put Botox, I make the opposite. I make Botox, for example, we put only on the sides here. So the other part of the muscle is still working, by the way. So it take the skin of here and here, or the part of this muscle relaxed to stretch this area. And when everybody smile, this muscle don't contract here, so don't make the lines here. Okay. So when people like normally, what is three zones? This is the most famous three zones. This frontals here, one zone. Yes, and here one zone, and here's three zones. Some people.
I have a question. So if someone have lines here and wants to make also eyebrow lift.
Yes. Look.
So how? Because if you put it here,
yes,
it will fall down.
Exactly. Normally people, when they ask, let us now continue about the upper, because also the lower part of the face we inject Botox. Okay, this is one muscle, this is one zone, and this is one zone, and the third for these lines one zone. Normally, when somebody asks me, I need eyebrow lift, it means the base of the skull, or like this zone and this zone, because their action is to put the eyebrow from this zone, put the eyebrow down from here, and this put the eyebrow down from here. So if I want the eyebrow lift, it should be these two zones. So this is the same meaning when the woman like ask about I need eyebrow lift, it means these two zones. Okay. Normally there are three zones. Normally, if patient need this zone alone, okay, no problem, because when I make it, it will raise the eyebrow. If they need this eyebrow zone alone, okay, when I make it, it raise the eyebrow down. If they want this zone, the side of the eye, and this zone, okay. But if they ever want the forehead zone, I should make with it this, like normally yes, a lot of people, by the way, only notice this horizontal lines and think this only they can make Botox here, and only that is. Look, we have in our muscles tone. Tone is the continuous contraction of the muscle without movement. Like normally now, this muscle now, I don't move it here, it's stretched, but there is tone, there is contraction. And by the way, the two muscles here and here, they are opposite to each other. If I stop this mid paralysis, or like some people who have stroke, if they have paralysis here, without moving this muscle, I will find they will find their arm normally go like this, because the tone, there is contraction always in the muscle. So normally now our eyebrow in this position, not only because like I should know that there is balance between the muscles that lifts the eyebrow and muscles that put the eyebrow down. If I inject here only, it will not only make the eyebrow down, but will look us this zone more stronger, because they work against each other. So if I release, like normally this muscle here,
so here will be
more stronger.
But more problems.
More problem.
Yeah.
So any patient ask for this zone, I should tell that you must do the three zones. But if they ask only if I need only this zone, okay.
But with this,
I must 100%, and I should explain, because if they make this, it is not only that the eyebrow will go down, or no. This zone will be very strong. Like they will look really angry. Like everybody sees them, they will feel like they are, because there is balance. Like there is this muscle take like this, and this muscle take like this, so it make balance. If I release here, I will look like this, almost. So, like if somebody wants this zone, I should have the three zones together. Okay. Also, there is some muscles in like for the zone between the eyebrows. I always do, if this is the nose, there is muscles here over the nose. When it's also I smile, or when the same like nerve which supply these muscles also come to this muscle to make these three lines and the horizontal line like this. So always when I do these three zones, I always put the here in the middle, or on two in one in each side. You know the bunny lines, these small three lines come here next to the nose. Here, these lines. This is because of this muscle. So I put in the middle, because it's very thin muscle. Over the bridge of the nose, I put it in the middle, or better on both sides. Okay.
But this one you put with which zone when you make it?
Yes, here. Zone? Yes. By the way, nobody asked about it, but you make it. Like nobody like.
But if you would make this zone, you would make it also, or no?
No. Normally, no. Look. Normally, how we should be. Each person is different. Some people. Yes. By the way, you don't need. You need only 2 units. 2 units. Not much. A small amount is okay. Like. Complementary for the patient. But normally, the clients who have these strong lines here and visible, 100% they need the three zones. like this line to be visible and strong, 100% the clients need the 3 zones already. They have tension in all the muscles. Okay, this is eyes. Okay, we go for the lower part of the face. This is the lips, okay? We should know that the lips is not only fat or some tissue that look like this. There is muscle in the lip called orbicularis oris. Oris يعني mouse. Orbicularis is circular muscles of the mouse. This muscle, if we take this two angle, you will find a lot of muscles from all directions attached to this angle. Okay, and here also in the chin, and also here from up. Okay, so what is the problem happen with people in this area? Number one, because we use our lips, like it's called, because the action of the muscle of this muscle is to close the lips firmly, so it contract like this, like this. So with time we get hyper tension in this muscle. So what we start to have from this contraction like this, we start to have the smoker's lines. Smoker's line is not because of people are smoking. Smoker's line, it is a line with everybody, but because the smokers, you can see when the smoking, when they make their lips like this, so you can see it. But if the same age, they don't smoke, they have the same problem. Because this problem also, this line come from the contraction of the muscle. We use this muscle from speaking, drinking, yes. So also, if I take line from the angle of the mouth, this here, for example, the masseter, the jawline angle, okay. If I take line from this angle of the mouth to this angle, all these muscles down here with time start to hypertrophy, like to be tense and stronger, because we use it all the time, not only when we speak. Yes, we use it when we speak a lot, but it works all the day, because we need it to swallow. When we use it when we swallow, when we eat, without we realize this, we use it all the time to push the saliva between our teeth and our cheeks, if fine particles. So it's always working. So normally it get tense. So when these muscles get tense, what will happen? This part will be hypertrophied. That's why the woman has start to have big area here, the jewels, this part and this part, because of this muscle. So, and plus the marionette line. This line, what come from the angle of the mouth, this is the lips, okay? This is the chin. This muscle, this line, by the way, if this is the nose, there is two lines around the mouth. One nasolabial fold, one line come from this part of the nose here, and another line come from here, the angle of the mouth here. They are two different lines and two different treatments. You understand? This line come because of the hypertrophy of the muscles here, and the hypertrophy always when we have hypertrophy. Hypertrophy it means means the muscle became big or stronger. And also when we have tension and hypertrophy in the muscle, always our body make more fat over this muscle. So the people start to have more fat here, plus the muscle became more big, then they start to have these lines, the marionette line. So if I need to fix the marionette line, I must fix the muscle, because this is the reason for all this. How to fix the muscle? Only Botox. So Marriott line, yes, like later when I explain to you, yes, we can use some fillers also, but it will be worse and look so bad if I don't fix the muscle. I will tell you how we fix the muscle here. But the line come from the nose to the side of the mouth. Sometimes they attach to each other, but they are totally different lines. You will find it's like come like the other, one line come like this, and the other one come from the angle like this. They are not attached together. So it's not one line. I mean, later I will explain the treatment is different because this line, the problem is not the muscle. Okay? So, this speak now about Marriott line and the smoker lines because of the tension of the orbicularis oris. And also with expression, people, there is muscle under muscle. The chin, our chin have muscles. This muscle contracts that put the chin up. What's this? I make Botox here so you can see. These muscles contract that to put the chin, the tissue up. So with time, because of this action and tension, and by the way, people use it a lot, when they have expression, they start to have this line here, stronger and stronger and stronger, plus some dips in the muscle itself, like the muscle, this muscle fiber attached to the skin. You find when you move, you find like orange skin part. Okay. Also, something around the mouth, the lips, the muscles over the lips. It's the action is to lift the eye, the mouth. When you smile, when you smile now, the muscles around the mouth. When you smile, this muscle work to open the lips. Okay. So some people have, and there is muscles here over the lips. Some people have hyperactive muscles. So when they smile, their lips go so up, like you start to see the gum.
Yes.
So also this what make gum smile.
Yes.
Okay, so this also we fix it with Botox with some points. Okay. So as I said now, if we take line from the angle of the mouth to the angle of the jawline, all this part get hypertrophied and big. That's why, and start to make fat. That's why, and by the way, with time we don't smile a lot. The muscles that we used to smile in the cheeks. So with time we don't smile. We are so sad, like not like before, or tired all the time. So we lose volume from here, and the muscle here became weak. While this muscle, because we have to use it, because we use it for a normal daily life, like speaking and eating, get bigger and more fat. So when this go, we lose the volume here, and we get more volume here. We feel like our face falling down, but our face is not falling down. It is just here we lost some volume, and here we add some volume. So the face not fall down. So if I need to fix this, I will tell you how to fix it with Botox. So we need to fix the problem with the muscle. It's a problem with the muscle. If we fix the problem with the muscle, your face, it called Botox lift. Something else also, I will explain each point to how to do it clearly.
Here it's more difficult.
But I tell you something, like once you know how to do the forehead good, it's enough. Why? Because this is what people notice in the mirror. This is how your clients, do you know, we study in Faculty of Medicine mode of presentation. How everybody come to me as a doctor or whatever, it's medical service. So how they come to you, normally they notice these lines. Nobody notices these lines down. Nobody notices the jewels. They don't see it at all. So if you can do the forehead good, this is the best thing. Because it's not much people will understand this even. Sometimes you have it, but I keep explaining, and the result is very slow over months. So if we speak about work now, to work in to make this business, you should only do small things you should have to do, like it's famous things, like gum smile, it's very famous, the smoker's line, and the three zones and the black here. This one, platysma. Look, this I continue now.
Okay.
This is the lips. This is the chin. Okay. From the this is the jawline. The neck, there is muscle attached from this is the neck. There is muscles in the skin of the neck. Very, very long, thin muscle come from here, the jawline, until the chest. It's in the skin itself. There is no like it's the origin and the insertion in the skin itself. This muscle contraction like this.
Like here.
Yes. Yes. So with time we start to have lines here. This because of the contraction like this. And also when you like this contraction also because the muscle is tense, you start to have like two thickness here, like hypertrophy in this area. You find like this parts here, here and here and here. Get hypertrophy. This is the platysma muscle, and this is the masseter muscle here in the angle of the mouth. When you find the woman have big face from this area and strong muscles here, and sometimes it's painful. This is the masseter. Normally, what people ask, and everybody famous, and if you do it only, you are good. You are the best. You don't need to make it even anything else. You don't need. The three zones. This one zone. This here together. The bunny lines. The gum smile. 1, 2, 3. And the smoker's line. Yes, this lip flip or smoker's line the same. This is the vermilion, the line of the lips, the outer line of the lips. This is the line where it exactly inject. Like it's only 4 units. Some people according to how it's strong and how the lips are big. If the woman very atrophied lips, like no lips, like skin, I don't put much Botox. Because normally 100% in all cases, if you just put 1 unit and 1 unit, it starts this like difficulty in speaking. 100% of cases, not one cases no, but only stay 2-3 weeks. So anyway, this points is only 4 points. Some people I put only like two in the middle here, only in the middle here. Okay. And in the chin, Botox in the chin is not so famous. Botox in the masseter and platysma muscle. How I make platysma muscle? It's not nothing to be scared. Just to stay away from this under the angle direct to be. But also, I can put here, for example. But I hold the skin like this. I inject in the skin. I hold the skin with my hand. I inject it, and it will be very safe. I will not.
But these two, it's one. It's here.
Yes. In the end, this masseter for mastication. Yes. For many reasons. Some people complain that they have this bruxismus. This must contract like this, like psychologically or sympathetically work. So they always have headache and pain in this muscle because some people have some nervous system. Always when they are nervous, they make their legs like this. They make it with their masseter, and sometimes when they are asleep, they keep making it. And when they wake up, they feel like they were in the gym.
So this one is connected with...
No, I mean the same. I mean some people make like when they are nervous, make like this. Some people make it like this. Like they have something of according to the character. Like some people, when they make, they like to make this. Or strong like because it's like this. So the most famous things, the 3 zones, and by the way, this can be only enough. Masseter muscle is famous. Smoker's line, people normally even don't like it. Normally they try before and they don't like it and say I don't want it again. Because they find this difficulty with speaking. And 3 weeks and sometimes yes. Yes, but normally it must happen, but sometimes you should understand, as I said before, that the Botox job is to restore the normal muscle function. If it happen, even we do it one time and they complain from this for 2-3 weeks, what we have done already, we restore the function, like we relax the muscle a little bit, even if the patient don't want it again. Anyway, in the beginning, don't do it. Anyway, and normally young clients don't need it, you know, and this is the most important.
Don't do it. What if someone will come and say, I want it?
Okay,
So you do it.
you do it, yes, no problem. You know, sometimes you do something and it's better to make the patient feel, don't charge for it, and don't make it because the clients do it. For example, sometimes I need it and I see it will be big problem from them from this, because they have high atrophy, strong atrophy. So sometimes I put the needle without injecting them, but I don't charge them.
But you just made that you
Yes,
do it for them.
they will be happy, so happy. Really, because you should control with psychology. We work in a luxury work, luxury. You are not a doctor. You are not cutting the pain. It is luxury thing. Some cases, for example, but also I explain, like it's some cases you have atrophy, it's like impossible. If because of the atrophy, 100%, once the lips move normally, you will see some lines. And so this, like normally with Botox we restore the normal function. Like I mean, only the hypertrophy, only the tension. But the things that happen with normal muscles, there is other problems, or like atrophy in the skin itself, dryness of the skin. You understand? Like for example, when people smile and they find this, there is 2 lines in nasolabial folds and minute lines. But some people older start to have these fine lines here. So I fix it with, it's come only when I move the muscle, but it's not problem from Botox. It's problem because of atrophy of the skin. Okay? Okay. Now I explain everything now normally.
Yeah, but for example, how you will later explain to me how you inject to have
Exactly. Yes, all this.
one.
Yes.
And for this treatment, what later you will explain to me if someone have here.
Exist. But we will speak about fillers also. We speak about Botox.
This one is not with Botox, it's with filler.
With fillers, yes. As I said, like when we do when we look to the patient, we look to four points. Number 1, after our bone of the face, the skull, there is muscles, a lot of all first muscles. So number 1, I look how to restore the more normal muscle function. So this is what we speak about now, Botox, to restore the normal muscle function. But this is number 1. Number 2, restore the normal volume. When with aging, we start to lose volume from our lips, from our mid face, from our you understand, cheeks became like this, atrophied. That's really true. So we need to restore the normal volume only with fillers. Number 3, restore the normal skin component, or thickness component, skin itself, skin. So the muscle come first. I should treat, like when you see clients, I should search for what I do with the muscles first. Then I search what I do with fillers. Number 3, I search what I do with the skin itself. You know, for example, your skin here, show me your skin. Your skin, no single line here. No single line. There are no wrinkles. But this is not only what gives us our age. You look to your skin and the skin of a child. You know? So it's not about the lines, it's about the appearance of the skin. With time, our skin get dry, get thin. You understand? So I should look for this skin, because even if you like you can see women, perfect muscles, work perfectly, perfect volume, no single line in their face, but you can still tell this is 60 years old, and she don't have one line in her face.
Yes.
But how? Because of the skin appearance, yes, of the skin. If
For
you
sure, 20 years old, they have different skin than
Exact-
30 years old, than 40.
yes, why? Because we lose the thickness, and there is some cells produce material, like we have natural hyaluronic acid.
Yes.
Okay, collagen. This thing is change.
Yeah.
So we need to work on this. This is part is the boosters, skin boosters, to boost the appearance of the skin. Number two, the fillers. This is to restore the volume. So whatever, for example, nasolabial fold or cheeks, this is the volume problem. If you try anything without to put filler, forget about it. 100%. You should understand this because a lot of like.
So this will not help. It must be filler.
It must be filler, 100%.
But how you recognize if it's needed filler or boost?
Because it's a very clear problems.
Okay.
It's everything is very clear. Nasolabial folds filler.
Okay.
It's very like I can show you faces.
For example, how you recognize if they need filler or booster?
Okay, because there is line of the filler. The tear through here, tear trough here, this line is volume problem. So we need filler here. But anything under the eye else is problem with the skin. But only the filler here. So if you have deep line here, exactly here, not anywhere else, so I need filler. But any part in the under the eye, it need booster or other treatment. I speak about restore the normal skin component. It's not only boosters, by the way. For example, the muscle function is not only Botox. There is also, because Botox is to treat the tense muscle or strong muscles, over strong muscle. But there is muscle became also weak. How we treat it? With yoga face, for example, something like this. I advise your patient with it. You can do it at home. This also together, like I need to make the weak muscle strong, and I need to make the strong muscles weak with Botox. Also the fillers. The fillers, to restore the normal volume of the skin, there is fillers which is two types. That's only fillers I mean. Like there is hyaluronic acid, cross-linked hyaluronic acid. Hyaluronic acid doesn't mean that it's filler. Cross-linked hyaluronic acid, it means this filler. Cross-linked is like that attach it together, that stay in, once I inject in one point, it stay in this point. Until our hyaluronidase break it down to premium, like the normal one. This normal one move. That's why the booster, there is hyaluronic acid booster. This is the premium hyaluronic acid. Once I inject in this point, it don't stay in this point. It's spread, move. And this is the migration, what we see after the filler, no cross-linked. Because the cross-linked filler, cross-linked hyaluronic acid, our natural hyaluronidase, we have hyaluronidase in our body. Once we inject, it start to work on it to break it down. So but it's in two steps. Cross-linked to release that attachment a little bit to make it premium, and this premium move in the skin. Number three, restore the normal skin bonus. By the way, it's like boosters. By the way, skin boosters, if we speak like more clear, anything to make in the skin to boost the skin. It doesn't mean to be only injections. It is mainly injections, yes. But there's like for laser, it considered a skin booster. HIFU, skin booster.
And microneedling for
Skin booster. Anything to work on the skin itself. To boost the appearance and the shining of the tightness, it is a skin booster. So skin booster doesn't mean that it should be only injection. Number four, to restore the normal fat distribution. Some people, you know, this point we don't reach it. Like anyway, from when we work good on the muscle and to restore the normal fat distribution, some people lose some fat from here and start to make fat here. Why? As we explained before, because of the muscles. The muscle here became more tense, have more blood supply, so it makes the body make more fat. Here becomes the muscle weak, so the fat became less. Also, that's why also yoga is good as a filler also. You understand? Restore the normal fat distribution. There is some actions we can do, like for example treats. Treats is considered like something to restore the fat distribution, like this. There is some also surgical things with surgical material without operation. I mean, we do it also to change the fat distribution. But also, if I know the reason from this, for example, when I see line and I treat with Botox, I should understand what, like, I mean, restore the fat distribution can be also with this other three things. Okay, if I understand good what happened. So now, as I said, we speak now about the muscle function, about the Botox. Okay, can we take a break?
Yes. How you will send me so this long?